So the Virtual Cardiac Rehab Program, or vCRP for short, is a model, an alternative model for delivering cardiac rehab, which uses technology such as the internet and the phone to deliver the service in remote areas and people who are less able to access it.
Patients referred to cardiac rehab are assessed for vCRP interest and eligibility at their intake visit. They may also come to the visit already aware and interested in vCRP from a variety of hospital and community sources. Once the patient decides to enroll, they undergo the usual care intake visit and treadmill test to evaluate functional capacity and for the purpose of exercise prescription. After the assessment, the patient gets additional training on how to use vCRP with the help of exercise physiologist or nurse. Once at home, patients are cared for by a remote case management team, including an exercise physiologist and registered nurse and dietitian. When exercising, the patient wears their heart rate monitor, which includes a chest strap and Bluetooth-linked watch or smartphone. The patient also takes their blood pressure before and after each session. At least twice a week, the patient uploads their data for their case manager to view and comment online. This includes their blood pressure, heart rate, and the rate of perceived exertion level, and if diabetic, their glucose levels. Diet information is also entered in the website for dietitian and team to view. A great feature of vCRP is the alert system. If no information is submitted, the patient and the case manager are alerted by the website and patient is contacted. The website also offers cumulative exercise and physical measure reports, as well as educational videos and links to resources available in their community. The case manager will monitor, analyze, and comment remotely on the patient's exercise data while building rapport with the patient through words of encouragement, supportive feedback, and answering any questions the patient may have along the way.
Just the ability to do that in my own time frame and still be able to do my work and that, plus the support was just awesome. I found it to be really good. Whereas if I would have only had the traditional program, I wouldn't have been able to participate at all in that.
Connecting without face-to-face contact has actually been more satisfying and easier than initially anticipated through the use of the website messaging, as well as our regular contact through televisits, and the fact that patients can personalize their profile with pictures, hobbies and interests. Rapport is easily established.
Virtual cardiac rehabilitation as a program is safe and effective. Research has shown this.
It actually does provide effective care for a population of patients that we've never been able to work with otherwise.
Well, the hope is that virtual cardiac rehab will prove to be a viable alternative for patients who need cardiac rehabilitation. We hope to see it expand across the Fraser Health Authority as well as in the rest of British Columbia and Canada alike.